Hey, Ms. Johnson, how you doing today? I'm Tracy Gourier. I'll be your nurse for today. I'm gonna hand hygiene. Can you identify your name and date of birth for me? All right, thank you so much, Ms. Johnson. So today we're gonna be doing an assessment of your chest wall. We're gonna be doing an assessment of your abdomen also. Is that fine? Okay, did you remove your shirt? I'm gonna exit the room, give you some privacy. I'm gonna re-enter my patient's room. I'm gonna hand hygiene again, and I begin by inspecting the anterior chest wall. I'm noting that there's no heaves or thrusting at the apex or the sternal border. Next, I'll begin to auscultate the heart. Starting at the second right interspace, I'll be auscultating the aortic valve. Next, to the second left interspace, I'll be auscultating the pulmonic valve. Onto the left sternal border, I'll be auscultating the tricuspid valve. Onto the fifth interspace, near the left midclavicular line, I'll be auscultating the mitral valve. Next, I begin to auscultate my patient's heart sounds and note the quality and characteristics and the apical pulse. Patient pulse was a 2+ bounding, 65 BPM. Next, I'll begin to palpate my patient's posterior tibial, femoral, radial, and also dorsalis pedis. So first of all, I'll start with the radial. Ms. Johnson, can you hold your hands out like this for me? I'll be palpating your radial arteries. Patient's radial artery was a 2+. Next, I begin by palpating my patient's femoral artery. So I will get my patient to lie down. And since I'm closest to my patient's right side, I'll begin my patient's left side. I'll begin to palpate my patient's femoral artery near the pubis. Now, Ms. Johnson, I'm going to palpate near the pubis just to let you know, just for ensuring patient privacy and being considerate. Make sure my patient is comfortable. Patient was a 2+. Next, I'll put my patient in a prone position, face down, and I'll palpate my patient's posterior tibial artery. Thank you, Ms. Johnson. Patient's posterior tibial artery was a 2+. Next, I'll begin to palpate my patient's dorsalis pedis artery down here near her foot. All right, thank you so much, Ms. Johnson. All right, next we'll begin our assessment on her abdomen. Our hand hygiene. Next, I'll clean off my diaphragm with an alcohol swipe while I'm at it, because I'm about to use it. All right, I'm inspecting the abdomen. I'm noting that there's no lesions or surgical scars or nothing that concerns me. Patient skin looks intact. Next, I'll begin to auscultate my patient's abdomen, starting in the right upper quadrant using my diaphragm. Moving on along. All right, thank you so much, Ms. Johnson. Next, I begin to indirectly percuss my patient's abdomen with my right hand firm, and then my left hand using it as a fist. Starting in the right upper quadrant, moving my way over. All right, thank you so much, Ms. Johnson. Is everything going well? Is everything okay? You feel comfortable? All right, great. So next, I'm going to get you to lie down, and I'm going to lightly palpate your abdomen. 1 centimeter in, I'm going to lightly palpate my patient's abdomen. Noting the characteristics. Next, I'm going to deeply palpate my patient's abdomen. About 5 centimeters in, I'm looking for any mild tenderness or anything that needs to be investigated. Okay, perfect, Ms. Johnson. When palpating my patient's right upper quadrant, I noticed around the liver, it was kind of firm. And another thing I would know around the left lower quadrant right here, near around the sigmoid colon, it was some mild tenderness, but that's normal and expected. Ms. Johnson, do you have any questions for me? All right, thank you, Ms. Johnson. I'm going to hand hygiene exit the room.